So there's a Fox News exit poll which asked people whether they support government-run health insurance, or whether they support switching over to a government-run healthcare plan, and which is phrased in a way as to get as few of people as possible to support it. If they phrased it as supporting a Medicare for all type system, that would be more of a way to get a higher percentage of people. But since faith in the government, as well as faith in institutions in general, have been plummeting over the last number of decades and number of years, that was a way to get as low of an answer as possible. But despite that phrasing, still 72% of people said that they would favor switching over to a government-run healthcare system, which is something that's been duplicated in a lot of other studies. I saw a Pew poll that showed that from 2019 to 2020, I think an additional 5% of people supported switching over to a government-run healthcare plan, to the point that it's like almost 2/3 of Americans, I think 63% of people said that they support it, including like 88% of Democrats and I think like 35-ish% of Republicans, which is interesting because no party, neither the Republicans or the Democrats, support that system. They support continuing the current private system. In terms of the Democrats, they do support continuing Medicare and Medicaid, but really all they want to do is continue to protect the ACA from Republicans' attacks on it and then build on it. But what building on it actually means is never specified, because there is no really further building on it, because fundamentally the problem with the healthcare system is that the insurance companies want to charge as high as premiums as possible, cover as few expensive people as possible, those people being old people, sick people, people with pre-existing conditions, so on and so forth, and they're going to find mechanisms to do that, even if they are regulated on specific areas like the ACA does. And the drug companies also want to charge as much as possible. They have kind of a monopoly on the drugs because of patent rights, as well as a market that is willing to spend anything that they need to in order to purchase those goods, because they are a necessity for living. If you are somebody with a health condition, you need to get the drugs, so you don't have the option of going to some other market and purchasing those if you live inside the U.S., which is why we spend more money on prescription drugs than any other country in the world, because of the stranglehold that the pharmaceutical industry has on the government and has on the supply of those prescription drugs. We're not even allowed to re-import drugs from Canada, which are manufactured in the United States by U.S. companies, and then shipped to Canada, where they're sold at a fraction of the price, because in Canada the government is allowed to negotiate for drug prices, but not in the U.S., because the pharmaceutical industry, or the pharma lobby, is one of the strongest in the country, and they've made sure to preclude Medicare from having that right in terms of negotiations. Now, the VA does have that right, and that's the reason that the VA charges about, like 40% less or so for prescription drugs than the rest of the population, because they at least are able to use their bulk buying capacity as a government to lower those prices for their consumers. But what's more interesting than the public opinion polling on a given subject, in this case, Medicare for all or government-run healthcare, what's more interesting than that is what the total contrast between public policy, as well, and political party positions, and then the positions of the populace. Because remember, the population is the people who's supposed to elect the representatives who run the government. And so, insofar as it's a democratic system, that overwhelming support for issues like Medicare for all, as well as all the other ones, which I haven't discussed, but there are many, many cases like this, that would be reflected in some, if not all, but at least, a substantial, or at least a representative portion of, decision makers and policy makers. That's not what we see. What we see is the total opposite. So you have, like in that Pew poll, like a extremely small minority of people supported getting rid of Medicare and Medicaid, or cuts to Medicare and Medicaid. That is the stated specific position of the Republican Party. So that's half the country, or half of the parties support that position explicitly. And it used to be the position of the Democratic Party. In fact, it was the position of Joe Biden as recently as 2011, during the Simpson Bowles negotiations. They were talking about, we need to cut the deficit. What are we going to do? We're going to cut Medicare. We're going to cut Medicaid. Also going to cut Social Security. These are the exact programs that have the most support bipartisanly among everybody, but they're the exact programs that are going to be on the chopping block. Why are they on the chopping block? The reason, I think, is pretty simple. It's because the people who dictate policy in this country belong to the 1%. They belong to, they're at the top of wealthy corporations. They come from a certain class of people. They donate to political campaigns and super PACs, and they hire armies of lobbyists, and that's where their political power and influence come from, which they impose on the elected representatives of the population to ensure that those preferences are what wins out to what the people actually prefer. And so they don't want Social Security. Like, they don't care whether they get another $900 a month, but that extra payroll tax, might, eat into their billions of dollars in wealth and assets. And same with the other issues, like their redistributive programs. They have ideological underpinnings, and oftentimes that say that you need to pull yourself up by your bootstraps, and their evidence that America's a meritocracy is that, look how much money I have and look how great I am, and so I'm going to have to impose these kind of right-wing libertarian economic philosophies on the rest of the population as well. Plus, I want to keep my money. And so that's what's reflected in public policy. And it's on issue after issue. And so there are many, many issues which there is no public support at all. One I can think of off the top of my head is the Afghanistan war. Like, a large majority of Americans want to end the Afghanistan wars. I don't have the percentages off the top of my head, but I'm sure it's a majority of Democrats and Republicans, and it's been going on for 20 years, and we don't even know why we're there. But it's not on the agenda. It's not on the agenda for Democrats. It's not on the agenda for Republicans. We went through a Bush administration, then 8 years of Obama, another 4 years of Trump, and we're still there. And it's because the military-industrial complex and the wealthy people within the halls of power and that influence congressional representatives have a preference for continuing that policy. And it's same with almost every single issue that you could think of. And so when you talk about the faith in government and the faith in people's belief that government is an institution which can actually provide benefits to their lives, why that's been decreasing for so long to a point where it's in the single digits, I believe, or extremely, extremely low. That's the reason why. It's because the powerful have co-opted what would be, rational ideas of policies that would benefit actual people's lives that a lot of other countries have implemented, or that the U.S. even used to implement policies like these in the past, but they're just not on the agenda anymore.